This is All India Radio. We now bring you a special program on COVID-19. Good morning, I'm Tanvi Taneja.
And I'm Sunil Barma.
The headlines. Complete lockdown in 30 states and union territories to break the chain of COVID-19 transmission. States asked to take strict action against violators. Prime Minister Narendra Modi asks people to take lockdown seriously and follow instructions to save themselves and their families. India Inc. urged by Prime Minister not to cut workforce, asks to allow employees to work from home. Finance Ministry says contractual employees to be paid during period of absence due to lockdown. Government closes incoming traffic to all 107 immigration checkposts. And domestic commercial airlines to cease operations from midnight tonight. As many as 30 states and union territories have announced complete lockdown in view of COVID-19 outbreak. The lockdown covers 548 districts across the country. Partial lockdowns have been imposed in Uttar Pradesh, Madhya Pradesh and Odisha. 17 districts in Uttar Pradesh, 37 districts in Madhya Pradesh and 5 districts in Odisha have been put under the lockdown. The Union Territory of Lakshadweep has only imposed restrictions on certain activities so far. Briefing media in New Delhi, Joint Secretary in Health and Family Welfare Ministry, Love Agrawal said the Cabinet Secretary has asked the Chief Secretaries of States and Union Territories to implement the restrictions strictly.
कैबिनेट सेक्रेटरी साहब ने एक लेटर जो है स्टेट के चीफ सेक्रेटरीज को लिखा है। उन्होंने स्टेट्स को थैंक्स किया है कि उन्होंने प्रॉम्प्ट एक्शन लिया है, जैसे कि गवर्नमेंट ऑफ इंडिया की तरफ से उनको जो हमने कहा था। और साथ में उन्होंने अपने लेटर में एक और स्पेसिफिक इशू जो हाईलाइट किया है वो कहा है कि जरूरत है कि स्टेट्स इस सिचुएशन को 24/7 मॉनिटर करें और साथ ही अगर जरूरत पड़े कोई और एक्शन लेना पड़े इन टर्म्स ऑफ इसेंशियल एक्टिविटीज के अलावा बाकी सारी एक्टिविटीज को रिस्ट्रिक्ट किया जाए तो उसको भी टाइमली डिसीजन लिया जाए और एडिशनल एरियाज में अगर रेस्ट्रिक्शन इंपोज करनी पड़े तो उसके लिए तुरंत कार्य किया जाए। उन्होंने ये भी कहा है अपने लेटर में कि जो रेस्ट्रिक्शंस हैं जो इंपोज की गई हैं उनको सख्ती से अमल किया जाए और साथ ही डिस्ट्रिक्ट मजिस्ट्रेट्स को, एसपीज ऑफ पुलिस को, पुलिस कमिश्नर्स और म्युनिसिपल कमिश्नर्स जो कंसर्न्ड अधिकारी हैं उनको सख्ती से इसको अमल करने के आदेश दिए जाएं।
The Home Secretary also asked the Director Generals of Police of the states to impose restrictions in a stricter manner.
ये जो रेस्ट्रिक्शंस इम्पोज किए गए हैं उनका रिव्यू करने के लिए, उनका एनफोर्समेंट रिव्यू करने के लिए होम सेक्रेटरी ने सारे डीजीपीज, स्टेट्स एंड यूटीज के डीजीपीज के साथ एक वीडियो कॉन्फ्रेंस की थी जिसमें कमिश्नर पुलिस दिल्ली भी थे और सारे स्टेट्स के साथ यही बातचीत हुई है कि दीज रेस्ट्रिक्शंस हैव टू बी इन्फोर्स्ड स्ट्रिक्टली और कोई भी अगर ये रेस्ट्रिक्शंस वायलेट करता है तो उसके खिलाफ एक्शन लेना है क्योंकि ये एक बहुत जरूरी कदम है जिससे कि हम कोविड का स्प्रेड रोक सकते हैं।
As many as 424 active confirmed cases of COVID-19 have been reported in the country so far, while 34 patients have been discharged. The death toll in COVID-19 has risen to 9 so far. Mr. Agrawal said the main objective is to break the chain of transmission.
कोई भी आदमी जो इन आदेशों का अमल ना करे, उसका उल्लंघन करे, उस पर कानूनी कार्रवाई की जाए। चीफ सेक्रेटरी को ये भी रिक्वेस्ट की गई है कि हर अधिकारी को ये बताया जाए कि आंशिक अमल हमारे ऑर्डर्स का जो होता है तो उससे जो पर्पस है इन्फेक्शियस डिजीज मैनेजमेंट का वो डिफीट हो जाएगा। तो उसके लिए ये इंश्योर करें कि जो भी आदेश दिए गए हैं उनका 100% अमल किया जाए। 30 ज्वाइंट सेक्रेटरी एंड अबव रैंक के ऑफिसर्स को स्टेट भेजा जा चुका है जो स्टेट से कोऑर्डिनेट कर रहे हैं इन टर्म्स ऑफ स्टेट की प्रिपेयर्डनेस क्या है। माननीय प्रधानमंत्री जी ने एक वीडियो कॉन्फ्रेंस भी ली थी मीडिया के साथ जिसमें उन्होंने मीडिया से रिक्वेस्ट की है कि वो भी उनको अपना सपोर्ट दें कि करेक्ट इंफॉर्मेशन मीडिया के द्वारा देश को पहुंचाई जाए। और ये पॉइंट भी आपको मैं हाईलाइट करना चाहूंगा, जो भी ये स्टेप्स हैं इन स्टेप्स का मुख्य उद्देश्य है कि कैसे चेन ऑफ ट्रांसमिशन को ब्रेक किया जाए।
Mr. Agrawal added that the government is augmenting its healthcare capacities and states have been requested to prepare dedicated hospitals for treatment of corona patients. Indian Council of Medical Research Director General Dr. Balram Bhargav said instructions have been issued to conduct COVID-19 tests, and 12 private laboratories chains with 15,000 collection centers have started testing.
टेस्टिंग के लिए फास्ट ट्रैक कर दिया गया है आईसीएमआर एनआईवी पुणे में और 2 किट मैन्युफैक्चरर ऑलरेडी अप्रूव हो चुके हैं और ये भी स्पष्ट किया जाना चाहता है इस समय कि ये एफडीए सीई अप्रूवल मैंडेटरी नहीं है। आईसीएमआर एनआईवी प्रमाणित भी जो टेस्ट किए जाएंगे वहां पे फास्ट ट्रैक बेसिस पे वो भी स्वीकृत है और इनका प्रयोग किया जा सकता है कोविड टेस्टिंग के लिए। इट इज रिकमेंडेड ओनली फॉर पर्सन्स स्टेइंग एंड केयरिंग फॉर a household positive patient. So if in a household there is a positive patient, they are laboratory confirmed patient and they are caring for him from very close, then they can take hydroxychloroquine only for prophylaxis, only for prevention, only in these 2 circumstances.
The Finance Ministry has said that contractual, casual and outsourced employees will be paid if they are unable to report on duty due to lockdown imposed by authorities. Finance Minister Nirmala Sitharaman said in a tweet that due to social distancing and isolation measures to contain the spread of COVID-19, there is a likelihood of number of contractual and outsourced staff working for Government of India unable to attend work. She said that this may result in deduction in wages, causing hardship to them. Mrs. Sitharaman added that the Finance Ministry has thus ordered to declare this period as on duty and wages should be paid accordingly. The instructions will also apply to attached subordinate offices, autonomous statutory bodies of Government of India till April 30th. No domestic commercial passenger flight will be allowed to operate from midnight tonight till 31st of March. The move comes amid the coronavirus pandemic. However, the restrictions shall not apply to solely cargo-carrying flights. India has already banned international flights for a week from Sunday. The Civil Aviation Ministry said that airlines will have to plan operations so as to land at their destinations before 23:59 hours tonight. Along with cargo flights, offshore helicopter operations, medical evacuation flights, or flights specifically approved by aviation regulator DGCA can operate as usual. The centre has decided to stop all incoming traffic at 107 immigration checkpoints to contain the COVID-19 outbreak. The checkpoints include all airports, seaports, land ports, rail ports and river ports. Vehicles and trains carrying goods for trade or essential goods and supplies are exempted from this prohibition. Manpower on board such vehicles will be allowed subject to thorough screening by medical staff.
In Uttar Pradesh, the number of districts under lockdown has gone up to 17 after inclusion of Jaunpur into it. It was announced by the government after one corona-positive patient was found in Jaunpur yesterday. Chief Minister Yogi Adityanath has appealed to citizens to stay indoors.
जनता जनार्दन से हम लोगों ने अपने घरों में रहने की अपील की है। इसमें स्वास्थ्य विभाग, नगर विकास विभाग, ग्राम्य विकास और पंचायती राज विभाग, इन सभी जनपदों में वहां पर क्लीनिंग और सैनिटाइजेशन की कार्रवाई को युद्ध स्तर पर आगे बढ़ा रहा है।
Meanwhile, the government has ordered strict compliance of lockdown. More from our correspondent.
Chief Minister Yogi Adityanath has appealed people to cooperate in fight against COVID-19. In his message, Mr. Yogi said the situation in the state is totally under control and people should not panic but fight against it. The government has instructed to quarantine the people arrived in the state from outside within last 2 weeks. Government has announced interstate boundaries of the state to get sealed. The government has asked strict compliance of lockdown in the state and to take stringent action against not obeying rules. Prohibitory orders under Section 144 have been imposed in all 17 districts of lockdown. Government has issued advisory not to gather more than 5 people at one place. In wake of COVID-19, anti-CAA, NPR and NRC agitation sitting at Ghantagar in capital city Lucknow has been suspended by women agitators. MS Yadav, Yaya News, Lucknow.
In Madhya Pradesh, curfew has been imposed in Bhopal and Jabalpur from midnight last night in view of the COVID-19 outbreak. Shivraj Singh Chauhan issued the orders just after assuming the charge of the Chief Minister. 7 cases have been reported in Bhopal and Jabalpur so far. More from our correspondent.
Apart from curfew in capital Bhopal and Jabalpur, around 40 districts of the state have locked down for different time periods. Section 144 has also been implemented in many districts. The administration has asked people to work from home. Almost all shops in the cities are closed. Buses, trains and all other transport services were also closed. So far, the number of corona infected has increased to 7 in the state. 6 positive patients have been found in Jabalpur and 1 in Bhopal. Cases of 75 probables from across the state were sent for the investigation, out of which 48 found negative and reports of 12 cases are yet to become. Sanjeev Sharma, AIR News, Bhopal.
The number of COVID-19 infected persons has gone up to 32 in Rajasthan. 4 new positive cases came up yesterday. In view of the outbreak, complete lockdown has been enforced in the state. The operation of all private vehicles will also be stopped across the state from this morning. At the same time, the toll plazas of the state highways have been closed. A report.
It will work 24/7 and people can contact on helpline number 181. At the same time, health war room will be operated for health services, for which help can be obtained by calling helpline numbers 108 and 104. In the crisis, many religious and social institutions and organizations have come forward to help the needy people. People and organizations have donated 21 crore rupees to the Chief Minister Relief Fund in a single day. 1,000 rupees will be provided to the construction workers and registered street vendors who have lost their livelihood due to lockdown. Jitendra Dwivedi, AIR News, Jaipur.
A complete lockdown has been implemented across Maharashtra, the state with the largest number of cases so far. Let's listen into this report from our correspondent.
The lockdown in Maharashtra due to the rise in cases of COVID-19 has impacted several services like the suburban local services of Mumbai, considered as the lifeline of the city as it ferries tens of thousands of commuters on daily basis, state transport buses and many other things which are directly or indirectly connected to a common man. However, the government had to act tough to suspend many of these services as people kept on using them despite consistent appeals to show restraint and avoid crowding the place. The latest to suspend the operations is the India Security Press and Currency Note Press units of the Vital Security Printing and Minting Corporation India Limited, based in Nasik in northern Maharashtra. The operations have been suspended till 31st of March in view of the novel coronavirus outbreak. The district administration in Nasik has put restrictions on fuel, allowing people to purchase fuel worth 100 rupees for 2-wheelers and for 4-wheelers 1000 rupees fuel will be allowed per day. Maharashtra Chief Minister Uddhav Thackeray has directed the divisional commissioners, district collectors, police officials and officials from municipal corporations to be serious in their work for next 15 days. Kunal Shinde, AIR News, Mumbai.
The lockdown has also been ordered in Gujarat. Our correspondent reports on the restrictions in the state.
Statewide lockdown has been imposed in Gujarat from the midnight. This was announced by the Director General of Police, Sivanand Jha, in a press conference at Gandhinagar last night. He said that statewide lockdown to check the spread of COVID-19 will be implemented with full force and utmost discipline. Mr. Jha said that all the borders with neighboring state have been sealed. He said that all vehicles, including private cars and bikes, will not be allowed on the roads except for essential services. He said that all essential services, including hospitals, medical stores, groceries, vegetable, milk shops, etc., will remain open during the lockdown. Earlier, the state government had issued the lockdown in 4 major cities, Ahmedabad, Vadodara, Surat and Rajkot, and 2 districts, Gandhinagar and Kutch, where coronavirus positive cases reported. The decision to impose the statewide lockdown has been taken after the spike of coronavirus positive cases in the state during the last 24 hours. 12 new cases of coronavirus positive reported from the state yesterday, taking the total number of positive cases to 30. Out of 12 new cases, 6 cases have history of foreign travels, while 5 cases are connected with the local transmission category. Yogesh Pandya, Air News, Ahmedabad.
Karnataka state government has declared complete lockdown across the state till March 31st. The lockdown was earlier limited to 9 districts where COVID-19 positive cases were reported. The non-essential services in the entire state will be shut down. Only essential services and other basic civic amenities will be allowed during the lockdown. The government-sponsored Indira canteens across the state will provide food to the poor without any charges. The High Court City civil courts, district courts, small causes courts, family courts and labour courts will remain closed from 24th of March to 6th of April. More from our correspondent.
The state government has taken several stringent measures to ensure social distancing to curtail the pandemic. Those under quarantine will invite legal action if seen in public. War rooms and task forces are in place to monitor the situation. Exclusive COVID-19 hospitals are being planned in all the districts with sufficient ventilators and other medical equipment. A 1,200-bed separate block will be created in Victoria Hospital in Bengaluru to treat COVID-19 cases, and another 1,200 beds will be pulled up by the private hospitals in the city. Private hospitals have come forward to spare the services of doctors and clinical staff working in their hospitals. To ensure that there is no more transmission of the virus locally, entry points to the states are closed down. Till date, over 1,27,000 passengers have been screened in Mangaluru and Karwar. There are 33 confirmed cases in the state with one death. Sudhindra, AIR News, Bengaluru.
Kerala enters into a complete lockdown as more COVID-19 cases were confirmed. Our correspondent has filed this report.
28 more COVID-19 positive cases were confirmed last night in Kerala, taking the total confirmed cases in the state to 95. Out of this, 4 people had already recovered from the disease. 95 people are presently being treated for COVID-19 in the state. The condition of all the patients are stable. Around 63,000 people are under observation in the state. Chief Minister Pinarayi Vijayan said that Kerala will be completely locked down till March 31st. State boundaries are closed. Only essential services will be allowed. Public transport will not function. Private vehicles are allowed. Gathering are completely prohibited. People going out without valid reason and those not following guidelines will be arrested or imposed with heavy fine. All religious institutions in the state will be closed. Mr. Vijayan said that the government will ensure that all essential commodities will be available. Shop will only open from 7 a.m. to 5 p.m. Medical stores are exempted from the time limit. Restaurants are not allowed, but home delivery and parcel service is allowed. Chief Minister further clarified that the newly confirmed cases are Dubai returned individuals and presently there is no evidence of community spread. He further urged complete support of the people to face this unprecedented challenge. Mayusha for AR News from Thiruvananthapuram.
The interstate borders of national capital Delhi have been sealed by police, except for the movement of essential goods and services. Yesterday, police imposed prohibitory orders under Section 144 of the Criminal Procedure Code, CRPC, in Delhi till March 31st in view of the coronavirus outbreak.
Strict checking is being done at the border pickets and internal pickets within the city in every police station area to ensure that no gathering or movement takes place in contravention of the prohibitory orders. Delhi Police said strict legal action will be taken against those found violating the prohibitory orders. To ensure compliance of the prohibitory orders, patrolling will be conducted and announcements will be made seeking cooperation of the people and informing about the legal action that violation of the orders may attract. Private organizations in Delhi engaged in essential services will have to seek curfew passes. The passes being issued by the Delhi police are only for the inter-border movement of people engaged in essential services. Government officials who are engaged in essential services will also be permitted to enter Delhi on basis of their identity cards. Media persons will not need the curfew passes and they can show their identity cards. Anupam Mish, AR News, Delhi.
This is All India Radio giving you a special program on COVID-19. Let's take a look at the headlines once again. Complete lockdown in 30 states and union territories to break the chain of COVID-19 transmission. States asked to take strict action against violators. Prime Minister Narendra Modi asks people to take lockdown seriously and follow instructions to save themselves and their families. India Incorporated urged by Prime Minister not to cut workforce. Asks to allow employees to work from home. Finance Minister says contractual employees to be paid during period of absence due to lockdown. Government closes incoming traffic to all 107 immigration checkposts and domestic commercial airlines to cease operations from midnight tonight. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Prime Minister Narendra Modi has exhorted industry stakeholders to adopt a humanitarian approach and not to cut down on workforce in spite of the negative impact on businesses due to COVID-19. Interacting with industry representatives through video conference from ASSOCHAM, FICCI, CII and several local chambers from 18 cities across the country, Mr. Modi asked them to allow employees to work from home wherever doing so is feasible using technology. He thanked the industry representatives for speaking in one voice on the needs of the unorganized sector and said that it marks a new dawn of economic integration. The Prime Minister has shared a link on information regarding COVID-19 in sign language via a tweet. In his tweet, the Prime Minister said that the link contains valuable information on COVID-19 in sign language. Mr. Modi has been taking to social media to disseminate information on ways to protect against the infection. Prime Minister Narendra Modi has said that many people are still not taking the lockdown seriously. In a tweet, he had urged people to follow instructions seriously and save themselves and their families. He said he has requested the state governments to get the rules and laws followed. The government has asked states to strictly enforce the lockdown in the areas where it has been announced in the wake of coronavirus outbreak. Legal action will be taken against violators. The Prime Minister has urged media representatives to launch Stay Home campaign so that citizens can understand the gravity of the situation and take the lockdown seriously. The Prime Minister interacted with media heads through video conferencing over COVID-19 outbreak yesterday. The Prime Minister has highlighted the importance of remaining indoors to break the chain of COVID-19 transmission. In his address to the nation last week, he urged people not to venture out of their homes and venture out only if necessary.
मेरा सभी देशवासियों से आग्रह ये भी है कि रूटीन चेकअप के लिए अस्पताल जाने की हमारी जो भी आदत रही हो उससे बचना, जितना बच सके बचना। मेरा सभी देशवासियों से ये आग्रह है कि आने वाले कुछ सप्ताह तक जब बहुत जरूरी हो तभी अपने घर से बाहर निकलें। जितना संभव हो सके आप अपना काम चाहे बिजनेस से जुड़ा हो, ऑफिस से जुड़ा हो सके तो अपने घर से ही करें। बीमारी से बचने और खुद के स्वस्थ बने रहने के लिए अनिवार्यता है, वो है संयम। और संयम का तरीका क्या है? भीड़ से बचना, घर से बाहर निकलने से बचना। आजकल जिसे सोशल डिस्टेंसिंग कहा जा रहा है, कोरोना वैश्विक महामारी के इस दौर में ये सोशल डिस्टेंसिंग ये बहुत ही ज्यादा आवश्यक है और कारगर भी।
The Ministry of Health and Family Welfare has advised people to follow basic protective measures so that they can keep themselves safe from the novel coronavirus. A report.
People should avoid participating in large gatherings. If a person is experiencing cough and fever, he or she should avoid close contact with others. People are advised not to touch their eyes, nose and mouth without cleaning their hands. Spitting in public places should be avoided. All persons should practice frequent hand washing with soap and water or use alcohol-based hand rub. Used tissues should be thrown into closed bins immediately after use. In case of fever, difficulty in breathing and cough, a doctor should be consulted immediately. The Health Ministry has issued a toll-free number 1075 for the public for inquiry about coronavirus. It has also issued an email ID ncov2019@gmail.com for any assistance on the pandemic.
And now we bring you some good news. A Pune-based COVID couple has tested negative after 14 days of quarantine at a hospital. They were part of a tourist group which returned to Mumbai from Dubai on 1st March. They travelled to Pune by cab. The daughter of the couple and the cab driver tested positive for the coronavirus subsequently. Yesterday, the couple's samples were sent for testing to NIV after they completed 14 days of quarantine at a hospital, and the tests have come negative. Testing facilities have been expanded. Instructions have been issued to conduct the test, and 12 private laboratory chains having 15,000 collection centers have started testing. First Made in India test kit to diagnose COVID-19 has got the commercial approval by the Central Drugs Standard Control Organization, CDSCO. According to the developers, it would cost nearly 1/4 of the current procurement cost and is faster as it screens and detects the infection within 2.5 hours as compared to over 7 hours by others. A group of scientists have analyzed reports from Wuhan Institute of Virology and published a research paper in latest edition of the Nature magazine. They've reported that hydroxychloroquine is effective in stopping the growth of novel coronavirus infection in laboratory conditions. According to the study, hydroxychloroquine has good potential to combat COVID-19. However, it depends on the results of clinical trials. US-based FDA is yet to give approval to the use of hydroxychloroquine for treatment of COVID-19. Back home, ICMR has recommended hydroxychloroquine for healthcare workers, persons caring for COVID-19 patients and households. World Health Organization is launching a multi-country trial to have a clear, strong evidence for effective treatment. Under this project, 4 drug regimens will be tested for COVID-19 therapy. These include an experimental antiviral drug, remdesivir, the anti-malarial drug, chloroquine or hydroxychloroquine, a combination of 2 HIV drugs, lopinavir and ritonavir, and a combination of the same 2 HIV drugs with an anti-inflammatory interferon beta. The drug combination was used in patients during the SARS and MERS outbreaks, and it appears to help. Remdesivir was developed to treat Ebola virus infections in Africa. Laboratory tests have shown that it can help stop the growth of novel coronavirus in the cells as well. The first human trial of a vaccine against novel coronavirus by a Boston-based biotech firm began last week. The first of the 45 healthy volunteers received their first dose of experimental vaccine. The vaccine will be studied first in a group of 45 healthy volunteers who have not been infected with novel coronavirus that causes COVID-19. According to experts, it will take at least over a year, maybe 18 months, for any vaccine to become available to the general public. It will also provide an insight into how the immune system can fight the virus. In Ladakh, people from all walks of life have joined the health fraternity to fight coronavirus. An innovative youth, Tamcho's Gourmet, has come up with an innovative zero-hand touch wash basin on Monday to fight with coronavirus. Our Leh correspondent has filed this report.
In this testing time in Ladakh, people are contributing their innovative ideas to fight with coronavirus outbreak. A youth, Tamcho's Gourmet, has designed a zero-hand touch wash basin with an aim to contribute something for the COVID warrior to ensure infection-free water tap for them for washing hands and returning home for their family without fear or infection by touching tap. Neatly designed wash basin need no hand touch. One can have a soap liquid drops, water to wash hands, tissue paper for wiping palms, just by a press by foot and get the hand wash. He demonstrated wash basin to Health Commissioner Secretary Rigzin Monday. He donated wash basin to SNM Hospital, which has isolation wards for coronavirus affected. Impressed with the design, Mr. Rigzin Sampel asked the designer of Gourmet to give the brief design details for further forwarding to Ministry of Health and Family Welfare. He also asked Gourmet for 2 more such wash basins for Kargil and Chushot, which are also fighting with coronavirus. With Ramesh Chandra, this is Yangchan Dolma reporting from Leh, Ladakh.
Amid the global outbreak of COVID-19, countries across the world are adopting severe measures, including lockdown, to contain the spread of the virus. In Britain, Prime Minister Boris Johnson has enforced the strictest curbs on movement of people for at least 3 weeks in the country. The death toll has reached 335 in the United Kingdom, with over 6,650 confirmed cases. And now for an overview of today's newspapers covering COVID-19 stories, it's over to VC Pramod.
Thank you, Tanvi. All domestic flights being suspended from midnight tonight to contain the corona outbreak gets top billing in most newspapers today. Locked down and grounded, headlines the Hindustan Times. Lockdown spreads state by state, leads the Indian Express. India seals off airspace to fight corona, reports the Pioneer. Curfew pass needed to enter city is the lead headline in the Times of India. Delhi borders sealed, IDs for essential staff, curfew passes for rest, writes the Indian Express. Tamil Nadu announced dedicated hospitals for COVID-19 patients, headlines the Hindu. Punjab first to declare curfew, writes the Tribune. West Bengal reports its first COVID-19 death, informs the Statesman. And finally, in news of some cheer, the Hindustan Times writes more than 1 lakh people of the over 3.5 lakh infected with the coronavirus disease have recovered worldwide. And with that, it's back to you, Tanvi.
Thank you, Pramod. And now, before we end the special news program on COVID-19, the headlines once again. Complete lockdown in 30 states and union territories to break the chain of COVID-19 transmission. States asked to take strict action against violators. Prime Minister Narendra Modi asks people to take lockdown seriously and follow instructions to save themselves and their families. India Inc. urged by Prime Minister not to cut workforce, asked to allow employees to work from home. Finance Ministry says contractual employees to be paid during period of absence due to lockdown. Government closes incoming traffic to all 107 immigration check posts and domestic commercial airlines to cease operations from midnight tonight. And with that, we end the special news program on COVID-19.